Today we are going to discuss about mandibular premolars. Mandibular premolars are four in number, two on the left side and two on the right side. It is immediately posterior to mandibular canines. Mandibular first premolar has four lobes and mandibular second premolar has five lobes. It has a large buccal cusp and which is functional and small lingual cusp which is non-functional. The form of mandibular premolars fails to confirm the term bicuspid, which means two functional cusps. Rather, its characteristic features are similar to that of the canine. Today, we are going to discuss about first one is mandibular first premolar. Like I said, it develops from four lobes. First one is mesiobuccal, middle buccal, distobuccal, and lingual lobe. Mandibular first premolar is the smallest of all premolars. It has two buccal cusps. It has two cusps. One is buccal cusp, which is functional, and lingual cusp, which is non-functional. It has single root is shorter than that of the canine. There are many characteristic features. It looks like a canine. First one is buccal cusp is long and only occluding cusp. Buccolingual measurement is similar to that of canine. Occlusal surface slopes sharply to the lingual in the cervical direction. Occlusal surface is more visible from the lingual aspect. Mesiobuccal cusp ridge is shorter than that of the distobuccal cusp ridge. There are five aspects which are discussed here in case of mandibular first premolar: the buccal aspect, the lingual aspect, the mesial aspect, distal aspect, and occlusal aspect. Mandibular first premolar chronology and dimension. The first evidence of calcification is 1 year to 2 years. Enamel completion occurs by 5 to 6 years. Eruption by 10 to 12 years, and root completion by 12 to 13 years. Below the table is the dimensions of mandibular first premolar. The cervical occlusion length is 8.5 millimeter. The hoop length is 14 millimeter. The mesiodistal diameter of the crown is 7 millimeter. The mesiodistal diameter of the crown is 5 millimeter. The labia or buccolingual diameter is 7.5 millimeter. The labio-buccolingual diameter at the cervix is 6.5 millimeter. The curvature of the cervical line is 1 millimeter. The curvature of cervical line in the distal is 0. Now, based on tooth numbering system, first one is FPI. It is the 3, 4, and 4, 4. Universal. Based on universal system, it is 2, 8, and 2, 1. Zygmomatic palmar system is denoted by 4 in the lower segment. First is the buccal aspect of mandibular first premolar. Buccal aspect is nearly bilateral. It is of a trapezoidal shape. The buccal cusp is sharp and little mesial to the center. There you can see the buccal cusp tip, which is very sharp and only little mesial to the center. Mesiobuccal cusp ridge is shorter than distobuccal cusp ridge. Mesial cusp slope shows concavity. This is the cusp ridge, which is shorter than the distal cusp ridge, and mesial cusp ridge shows a small concavity. The outline is slightly concave above the cervical line, and curvature or convexity is marking the contact area. The mesial contact area is more occlusal or middle of the middle third of the crown. The distal outline is slightly concave, and broader convexity marks the contact area. The buccal ridge extends from the cervical line to the cusp tip. The shape of the crown is roughly trapezoidal. You can see the line bisecting the center of the tooth The midline shifts towards midline or the cusp tip shift towards slightly towards the mesial aspect. The mesial contact area is more occlusal. Distal contact area is much more broader. The cervical line shows concavity in both aspects. The apical third of the root shows distal curvature. These are the important features of buccal aspect of mandibular first premolar. Next is the lingual aspect. Lingual aspect, the crown and root tapers towards lingual. So there is lingual convergence. The lingual cusp is sharp, short, and in alignment with the buccal triangular ridge. It is only 2/3 the height of the buccal. There is an important developmental groove which is seen in the lingual aspect. That is mesio-lingual developmental groove. It is a line of demarcation between mesio-buccal lobe and lingual lobe, extends from the mesial fossa of the occlusal surface to lingual aspect. The occlusal surface slopes towards the lingual aspect in the cervical direction. So we can see occlusal surface from this clearly from this aspect. You can see here the crown constrict towards the lingual aspect. You can see both buccal cusp and lingual cusp. The buccal triangular ridge is in the same line of the lingual triangular ridge, and mesio-lingual developmental groove, which decides the side of the, which decides whether the premolar is right or left. So, lingual developmental groove, which is continuous with the mesial triangular fossa, and it is seen in the aspect of the crown. Now, two marginal ridges are seen, mesial marginal ridge and distal marginal ridge. The same like crown, the root also converges lingually. Next is the mesial aspect. The crown is rhomboidal shape. The buccal outline is curved from the cervical region. The buccal cusp tip is centered over the root. The crest of curvature of the buccal outline is in the middle third of the crown. The lingual outline is less curved. The cervical crest of curvature is in the middle third of the lingual outline. The lingual cusp tip is in the line with the lingual border of the height of the lingual cusp. The height of the lingual cusp from the cervical line is 2/3 of that of the buccal cusp. The mesial marginal ridge deeply inclined sharply to the mesiolingual developmental groove. The mesial surface is smooth, convex. The contact area is centered and concave below it is the cervical line. The cervical line curves occlusally 1 millimeter. Deep developmental groove can be seen from the root from this aspect. Here, the crown bisects through the buccal cusp. The buccal cusp tip is in the same line of the line that bisects the crown of the tooth, and lingual cusp tip is in the same line of the lingual border, which is denoted by a dotted line. The circle represents the lingual contact area. The height of the lingual cusp is only 2/3 of the height of the buccal cusp. As we can see here, the lingual sloping is more towards the occlusal surface. So the occlusal surface of the crown is seen more from the lingual aspect. And much more important feature is the mesial marginal ridge, which is continuous with the mesiolingual developmental groove. So mesial marginal ridge shows more sloping compared to that of the distal marginal ridge. Next is the distal aspect. The distal marginal ridge is horizontally based, right angle to the central axis. There is no developmental groove. It is continuous with the lingual cusp, and the surface is smooth and convex. The distal contact area is broader and it is in the central axis. There is a linear concavity near the cervical line. below the curvature. There is a shallow developmental depression in the group. This line shows the distal marginal ridge, which is continuous with the buccal crest back towards the lingual crest, because there is no developmental groove separating the marginal ridge from the lingual crest. This distal marginal ridge is horizontal, so it is perpendicular to the line that bisects the crown and crucial aspect. From the occlusal aspect, the crown appeared to be like a diamond shape. These are the following characteristic features which are seen from the occlusal aspect. Middle buccal lobe forms the major bulk. You can appreciate buccal ridge, mesiobuccal and distobuccal line angles from this aspect. The crown shows broader contact area can be visible from the crucial aspect. The crown converges sharply to the lingual surface, which is a feature seen also in the canines. It has a well-developed marginal ridge and a small lingual cusp. The lingual cusp and the lingual triangular ridge and small lingual the buccal triangular ridge and lingual triangular ridge is in the same alignment. We can appreciate mesial and distal triangular fossae. Mesial fossa extends to the groove that is mesio-developmental groove, which is in continuous with the mesiolingual developmental groove. The distal fossa contain distal developmental groove. This image shows the occlusal surface of the mandibular first premolar. You can see more of the buccal surface aspect because the crown converges lingually. You can appreciate the buccal cusp, which takes the major bulk of the crown from this aspect, especially the middle buccal lobe. And mesiobuccal cusp ridge and distobuccal cusp ridge. So you can see appreciate the concavity of the mesiobuccal cusp ridge from and these two marginal ridges, medial marginal ridge and distal marginal ridge. Medial marginal ridge is continuous with the mesiolingual developmental groove, and distal marginal ridge is much more higher placed and which is continuous with the buccal cusp and that of the lingual cusp. There are two triangular fossae, medial triangular fossa and distal triangular fossa. The triangular fossa travels to mesial developmental groove and ends in the mesiolingual developmental groove, whereas distal triangular fossae is continuous with the distal developmental groove. Next is the mandibular second premolar. Mandibular second premolar develops from 5 lobes, 3 buccal lobes and 2 lingual lobes. It occurs in 2 forms. There are 2 cusp types for mandibular second premolar. 2 cusp type and 3 cusp type. In 2 cusp types, there are only 2 cusps, whereas 3 cusp types, there is 3 cusps are present in 3 cusp types. 2 cusp type is more rounded and has a buccal and lingual cusp. 3 cusp types is more angular. It has a buccal cusp and 2 lingual cusps. Okay. And has a larger, compared to the mandibular first premolar, it has a larger and longer root. We have 5 aspects which can be discussed here. That is buccal aspect, lingual aspect, mesial aspect, and distal aspect, and occlusal aspect. We are making a comparison between the mandibular first premolar here compared to mandibular first premolar. The mandibular second premolar has blunt cusp and it is less pointed. Mesial and distal contact areas are broader and broad root with it has a broad root with blunt apex. As you can see in this image, it has a very short and blunt buccal cusp The mesial cusp ridge is smaller than distobuccal cusp ridge. You can see distobuccal cusp ridge shows a small concavity here, whereas distobuccal cusp ridge is shorter than distobuccal cusp ridge. The buccal outline is in the middle third. It shows the concavity from the mesial outline, and towards the cervical, the buccal outline shows convexity in the occlusal and middle third, and towards the cervical line it shows concavity. Same way, distobuccal outline shows convexity in the occlusal and middle third, and concavity constricts towards the cervical line. The root is longer and it has a larger root. Compared to mandibular first premolar, it has a well-developed lingual lobes. Pre-cusp variant has two lingual cusps, that is mesiolingual, distolingual. The lingual development will extend a short distance to the lingual surface. Two cusp form has only one lingual cusp. Distolingual developmental depression is present in case of two cusp model, and crown converges lingually from the lingual aspect. As you can see in this image, the height of the lingual cusps, which are well developed, is almost same as that of the buccal cusp. We have two lingual cusps here, mesiolingual cusp and distolingual cusp. Mesiolingual cusp is larger than distolingual cusp. Of the three cusps, the largest cusp is the buccal cusp, followed by mesiolingual cusp, and the smallest one is distolingual cusp. The mesiolingual cusp help to identify the sides of the mandibular second premolar, whether it is a left premolar or whether it is a right premolar. Another important feature you can see from this aspect is a lingual developmental view that separates the mesiolingual cusp from the distolingual cusp. Okay. And unlike mandibular first premolar, the occlusal surface is not visible from this aspect, mainly because it has well-developed lingual cusps. But the crown shows slight convergence towards the lingual aspect. Same way, the root also shows convergence from the lingual aspect. The tooth is wider buccolingually. Buccolingual aspect, it is more wider. The buccal cusp is shorter and the tip is not centered over the tooth. So this is different from that of the mandibular first premolar. The lingual cusps are well developed. The marginal ridge is the right angle to the long axis of the crown. You can see the buccal cusp. It is placed buccally from when we compare with that of the mandibular first premolar. We have mesiolingual cusp, almost same height of the buccal cusp tip. The mesial marginal ridge is horizontally placed and it is perpendicular to the central axis. Also, the root is blunt from this aspect. The crown has crest of curvature towards the cervical third, but here it is from the lingual outline, the crest of curvature is towards the occlusion or middle third of the crown. The contact area is broader and occlusion be placed in case of mandibular second premolar. Similar to the mesial aspect, the distal marginal ridge is comparatively lower level than the mesial marginal ridge when the tooth is posed vertically. So the occlusal surface is more visible from the distal aspect because distal marginal ridge is placed lower level. Now, the occlusal aspect can be seen from distal aspect very clearly. The distal marginal ridge is placed at the lower level compared to the mesial marginal ridge, and buccal aspect can be appreciated here. The crest of condor is cervical third of the buccal aspect, whereas the rest of condyle is in the middle or occlusal third in case of lingual aspect. The distal margin of which is continuous with that of the cusp, and it is also continuous with the distolingual cusp. Occlusal aspect, to discuss the occlusal aspect, like I said, it exists in two forms, 3 cusp type and 2 cusp type. First, we will discuss about 3 cusp type. The occlusal outline appears squarish and mesiolingual cusp is bigger than distolingual cusp. All the 3 cusps has a well-formed triangular ridges. The developmental groove converges the central pit and form a Y pattern. As we can see here, the middle buccal lobe is still well developed here. The 2 lingual lobes are also well developed. We can see the outline, major outline of the buccal aspect from this, and it has a well developed lingual cusps also. Among the 3 cusps, the greater one is buccal cusp, followed by mesiolingual cusp, and then distolingual cusp. A developmental groove arises from the mesial triangular fossa and travels and ends in the central area. Same way, the distal developmental groove arises from the distal triangular fossa and ends in the center. Lingual developmental groove arises from the central pit and travels between the mesiolingual cusp and distolingual cusp. So altogether, the mesial developmental groove, the distal developmental groove, and lingual developmental groove, which gives a Y pattern. So this is the central pit. Three triangular ridges can be appreciated from this aspect, that is buccal triangular ridge, mesiolingual triangular ridge, and distolingual triangular ridge. 3 triangular ridges can be appreciated from 3 cusp types. Next one is 2 cusp type. The occlusal outline is rounded. There is a slight lingual convergence for the mesial and distal surface. So compared to the 3 cusp type, the ground convergence shows lingual convergence. More lingual convergence can be seen here. The central developmental groove travels in a mesial distal direction and has its terminals in the mesial distal fossa. The configuration of the developmental groove here is U or H pattern. The developmental depression crossing the distolingual cusp ridge can also be appreciated. This is the buccal cusp, the single lingual cusp, a deep developmental depression, that is distolingual groove, and crescent shaped occlusal groove can also be seen here, which ends in the mesial triangular fossa, and in the distal it ends in the distal triangular fossa. So you can see the distal triangular fossa here, and here is the mesial triangular fossa, and which is connected by a central developmental groove. We say H shape or U shape. It shows the second premolar, which is 2 cusp type. This completes the lecture.